My name is Tristan Martin, and today I'll be doing the risk assessment of Fairbanks Memorial Hospital. The agenda today is the objective, the stakeholders, key terms, background, hazards and threats, key assumption, risk matrix, top risk, vulnerability assessment, mitigation measures, measuring mitigation effectiveness, recommendations, and references. So a few key objectives are making sure that the hospital delivers high quality patient care, promoting community health, ensuring accessibility, support healthcare workforce excellence. Basically, that is attract, train, and retrain skilled healthcare professionals while fostering a supportive and inclusive work environment. We also have maintain financial stability, operate effectively to sustain the hospital's ability to serve the community long term, advance medical technology and innovation, emergency preparedness and response, focus on patient-centered care, and promote sustainability. So our top stakeholders are healthcare professionals, which are doctors, nurses, therapists, and technicians who provide care, hospital staff, administration support, and maintenance staff, essential for daily operations, healthcare partners, clinics, primary care providers, and specialist practice that prefer patients or collaborate on care, suppliers and vendors, which provide the medical equipment, pharmaceuticals, and other necessary goods and services, insurance providers, companies that cover patient care costs and interact with hospital billing systems, regulatory bodies, state and official agencies ensuring compliance with healthcare regulations and standards, for example, Centers of Medicare and Medicaid Services, OSHA, and the FDA. Educational institutions, universities, nursing schools, and medical schools collaborating for training, research, and clinical placements. Public health agencies, state and local health departments working with the hospital on public health initiatives. Emergency response agencies, fire departments, EMS, law enforcement, and emergency management organizations involved in disaster preparedness and responses. And lastly, patient and families, the primary beneficiaries of the hospital services. So the key terms I'll be going through today are risk, threat, hazard, vulnerability, and consequences. So a little bit of background about the hospital. Ownership and operations of the Fairbanks Memorial Hospital is part of the Foundation Health Partners, FHP, which is a community-owned, not-for-profit health system. Founding the hospital was established in 1972, serving as a cornerstone of healthcare in the interior Alaska. And the capacity, Fairbanks Memorial Hospital is a 152-bed acute care hospital, making it the largest hospital in the interior Alaska. Hazards and threats. So our natural disasters are earthquakes that are above or equal to 9.2 magnitude, tsunamis, wildfire, severe winter storms, which is above 12 inches or more, and flooding. Our man-made disasters are cybersecurity breaches, poor air quality, oil spills, grid failure, and highway transportation disasters. The key assumptions of the Fairbanks Memorial Hospital is that hospitals have access to essential medical supplies, pharmaceuticals, and equipment throughout delays due to Alaska's remote location may occur. Another one is the hospital's facilities are designed to withstand Alaska's supreme weather conditions, ensuring operational continuity. Fairbanks Memorial Hospital will continue to serve as a primary healthcare hub for Fairbanks and surrounding rural and remote communities in Alaska. Hospital will sustain funds through a mix of private payers, Medicare, Medicaid, and philanthropic support. And lastly, Fairbanks Memorial Hospital will continue investing in medical technology and IT systems to enhance patient care and operational efficiency. So a little of my risk matrix is the earthquake magnitude is high but unlikely. Our flooding is high and possible due to our so much snow's going on in the wintertime, and when it melts, we have flooding issues. Our grid failures and cybersecurity breaches are high and likely because cybersecurity breaches happen all the time in this decade, and grid failure due to our severe weather storms, power could go out, and such things. And wildfire is high and almost certain because every summer we have wildfire issues, and that could be a problem. Our tsunamis and oil spills are somewhat of a medium, disasters, but rare. Highway transportation disaster is medium on the scale, but it's very possible because highway incidents happen all the time, depending on how the roads are with our winters, harsh winters, could be icy. And our severe winter storms and poor air quality is medium, but almost certain. Poor air quality is due to our wildfires, and our severe weather storm just because of our harsh winters. And the other one, our oil spills and tsunamis are rare. Our oil spills is medium risk, and our tsunamis are low risk because they're less likely to happen. Our earthquakes are high in the disaster scale, but unlikely of that big of a magnitude. Cybersecurity breaches are high and possible, and our flooding and highway transportation and disaster is medium and possible as well. Our grid failure is high and likely due to the damages, and if we have no power in our hospitals, then our hospitals won't be able to operate as smoothly. Poor air quality, wildfires, and severe weather storms are, in the almost certain quality, but the poor air quality is high, wildfires are medium, and our severe weather storms are low. Our top risk. Economically, our wildfires is the risk matrix score of 20. The second highest is our grid failure / cybersecurity breaches, which is in a 16 score, and our winter storm / poor air quality is a 15. Our human disasters, poor air quality 20, our grid failure 16, and our wildfires being 15. Our vulnerability assessment, based off my risk matrix, the physical is low / medium of vulnerability. Our human is very high vulnerability, and our cyber breaches are medium vulnerability. Mitigation measures for wildfire is to update infrastructure to fire-resistant materials for buildings and utilities. For our poor air quality, which is for promote renewable energy sources to reduce emissions from fossil fuels. For cybersecurity breaches is to establish incident response plans and perform regular penetration testing. For our grid failures is create protocols and rapid deployment for repair crews and equipment. And our severe weather storms is also having a backup generator as well, just in case the power goes out, and to have the public do ice work so that the roads will be clear enough so that patients are able to go towards the hospital. And our measure mitigations, wildfire, the measure effectiveness is defensible space compliance, percentage of properties meeting fire safe landscaping guidelines. For poor air quality is the pollutant reduction, decrease in concentrations of pollutants like PM 2.5 and ozone. Cybersecurity breaches is employee training effectiveness, increasing in successful phishing detection rates. And grid failure is backup power capacities, which is increasing availability of backup energy systems. A few recommendations that I have discovered is for emergency training and drills, which is regularly train hospital staff on hazard-specific response protocols, including evacuation shelter in place and patient surge management. Community collaboration, partner with local emergency management agencies, fire departments, and public health entities for coordinated plans and resource sharing. Hazard monitoring and communication, installing monitoring systems for hazards like air quality, power outages, and weather, and establish communication protocols to disseminate alerts internally. And lastly is resilient infrastructure investment. Is for the hospital to consider retrofitting the hospital withstand hazards like earthquakes or severe storms, and ensure critical systems are redundant. And these are my references, and I hope you guys learned a lot from this presentation, and I hope you have a good day.